Hello, doctors. Very nice today to have you with us. Our followers are very interested to know a few questions about the embryo transfer.
Yes.
Our first question is going to be, what is embryo transfer?
Embryo transfer is the last step of IVF treatment. When the embryos are produced in the laboratory, they are just selected according to their morphological or genetical criteria. Then one to be transferred is selected. On day 3 or day 5, that embryo is ready to get into the mother's womb, the uterus. And the best embryo is put inside the uterus with a soft catheter, and that is called embryo transfer.
What are the differences between embryo transfer and freezing?
In IVF cycles, there are 4 steps. In the initial step, we just stimulate the eggs. That's called ovarian stimulation. When the many eggs are produced inside the body, we collect the eggs with oocyte pickup. That eggs are evaluated in the laboratory. On the same days, the man gives sperm cells and the fertilization is done with microinjection. Then the embryos are produced in the laboratory. Those embryos are kept up to 3 to day 5. And these embryos can be selected for embryo transfer or can be selected for freezing. In some cycles, we do the 4 steps one by one. We start with the egg stimulation, we end up with embryo transfer. In some cycles, in selected cases, we go up to producing of the embryos, but we don't transfer them, we do the embryo freezing. After that, anytime you can transfer the embryos in later stages, later cycles, menstrual cycles of the women. That is called total embryo freezing, without any transfer in the same cycle.
What tests and evaluations are performed before embryo transfer?
Before starting the IVF, all the tests has already been done. But for the embryo transfer to be done, you need to know the embryo's grading. That grading means the best embryo is to be selected for transfer in order to get pregnant. We need to know the grades of the embryos. We need to know how many to transfer. We need to know we will do the fresh transfer or frozen embryo transfer. According to these characteristics, according to these steps, we plan the embryo transfer. If the woman is having a lot of eggs, which carries a risk of ovarian hyperstimulation, then you just plan for a freezing embryo cycle. If the woman is having high progesterone levels during the cycle, then you plan for a freezing embryo cycle. If the woman is having some uterine issues like endometrial polyps or fibroids, then you need to freeze the embryos and do the embryo transfer in another cycle. But in the initial step, everything is planned for a fresh embryo transfer. Then you can do the embryo transfer at the end of the same cycle. Otherwise, you need to do a frozen embryo cycle. If you're planning for a fresh embryo cycle, you just have to prepare the patient with progesterone hormones after egg pickup. If you're planning to do a frozen embryo cycle, then you will start with the first day or second day of the period. You will stimulate the endometrium with estrogens or in a natural cycle with egg stimulation, and then you will give some progesterone hormones, then the patient is ready for embryo transfer. That depends on what you are planning.
How is embryo transfer performed and what steps are followed during the process?
Embryo transfer is performed in the IVF laboratory because the embryos are already waiting for the mother in the laboratory. It's like an operating room. When the patient is laying down on the special operating table, one of the nurses or just technicians holds up an ultrasound from the abdomen to see the uterus. We need to put the embryo in the correct place in order to get the pregnancy test positive. So without any anesthesia, you will not need it. The patient comes with full bladder, without anesthesia, without any pain, with a small catheter. The embryologist brings the embryo. Then 1 or 2 embryos, doesn't matter, with the same catheter, we put inside the embryo to the uterus under visualization with the ultrasound.
Okay. What are the techniques used during embryo transfer, if there is?
Every doctor has a different technique, but there are some rules, whatever you choose, okay? You shouldn't touch the upper side of the uterus. That transfer has to be very soft. There should be no bleeding. The catheter has to be clean. The embryos has to be perfectly selected. It's better you do it under ultrasound guidance with full bladder. There are some rules about it, but there are some small changes in the technique which we are doing it, or in the laboratory there are some different kinds of techniques when they are loading the catheter with the embryo. But if you're just having the rules step by step, success rate doesn't change.
Is local anesthesia or sedation used during embryo transfer?
No need for any of that, but because it's a very simple thing to do, no pain because there is no needle, no injection, nothing, just with a soft plastic cannula, you put the embryos inside the uterus. But if the patient is very afraid of the procedure, if the patient has too much anxiety, if she has vaginismus-like sexual problems, then she can have some sedation or anesthesia.
How long does the embryo transfer process take?
5 minutes or less, that's all.
Very short. How is the patient prepared before embryo transfer?
With the hormonal supplementation or with a natural cycle or after a fresh embryo transfer, that changes. That is to be discussed about the patient's all the medical histories.
What medications and hormone treatments are used before embryo transfer?
Even if it's a fresh or a frozen cycle, a progesterone is a must. If it's a fresh embryo cycle, after the egg pickup, the patient will have progesterone supplementation, usually always by vaginal route. Sometimes we add intramuscular or subcutaneous injections of progesterone also. If it's a frozen cycle, first estrogen and then progesterone, or sometimes in natural cycles with any other kind of pills, but progesterone is the most common used pill. Without progesterone, you cannot catch up a pregnancy test positive.
What are the recommendations regarding nutrition and lifestyle before embryo transfer?
Before IVF, before embryo transfer, if the patient is having a medical condition, that has to be treated. The patient has to be ready for pregnancy. So everything has to be checked before the IVF, before embryo transfer. If she's having endocrinological issues like thyroid problems, like blood sugar, irregular blood sugar problems, diabetes, or if she's obese or overweight, if she needs some lifestyle changes, these all has to be corrected before starting up IVF or before starting the embryo transfer.
How is the psychological state of the couple evaluated before the embryo transfer?
We usually consult the patients and we have a long time together during planning all these treatments. So we usually understand what the couple is feeling at that moment, but not before the transfer, but after the transfer, waiting for that 10 to 12 days for HCG test is really more anxious for the couple. At that point, they need more support physiologically.
How are the embryos used in embryo transfer selected?
It can be morphological grading. It can be genetically tested embryos. That depends. Normally, in standard IVF cycles, the laboratory has some universally accepted gradings, okay, on day 3 and day 5. Those embryos are selected by morphological grading systems because the best embryos are the good ones with good quality that gives us pregnancies. Slow developing embryos, arrested embryos, bad quality embryos don't give us any pregnancy test positive. So we can select in standard by morphological, these grading systems, or in some couples or in elderly aged women going under IVF treatments, or with women with miscarriages, or women with genetically diseases, carriers of diseases, we do embryo genetics. So we also can select the embryo with normally genetical chromosome numbers or healthy embryos without any diseases.
What are the success rates of embryo transfer?
The success rate of IVF, the major factor is the woman's age. The second factor is the number of eggs we collected. The third factor depending the success rate is the embryo quality. If the woman is younger than 35, if she is at the egg pickup having more than 10 to 15 eggs, if she has best quality embryos, the embryo transfer will end up with, in young cases, like 45-60% changes success rate. But if she's older, if she's having low number of eggs, that chance rates always drop.
How does embryo quality determine success rate?
These are in the IVF is like 45 years old, okay? The first babies are born 45 years ago. So we know a lot about embryos now. We know which wheel under the microscope ends up with pregnancy. That is called embryo quality. On day 3, we check the number of cells inside an embryo. If these cells are equal to each other or not. If there is any fragmentation inside the embryo. These are the parameters for an embryo quality. On day 5, there are 2 cell lines, which the outer cell line is the trophectoderm, cells where the placenta grows. The inner side is called inner cell mass, where the embryo grows. These cell lines are just numbered, graded, and these grades shows us which will end up in pregnancy. So these grading systems are universally accepted, and the embryo's developing stages, the embryo's rate of developing are all followed up. That's why we can select the best embryos by this guidance.
How does the implantation process work after embryo transfer?
When the embryo is put inside the uterus with a small catheter called embryo transfer, it will just move around the uterus a little bit, and in few days it will start attaching and growing, okay? And then it will start just secreting the hormone, the pregnancy hormone, HCG. Then you will know in blood that you're pregnant or not. The selection of the embryo is also selected from the uterus, and the embryo is also selected by the embryologist, and this ends up in pregnancy and implantation.
What are the risks if more than one embryo is used in embryo transfer?
Up to 3 embryos, it increases the pregnancy rate. But more than one embryo transfer also increases the multiple pregnancies, like twins, triplets. So it's better to have one healthy pregnancy at once. But if you're having more than 2 embryos transferred, then there is a risk of multiple pregnancies. It might increase the pregnancy rates a little, but not more than 3 ever should be transferred.
What symptoms are typical after embryo transfer?
There will be no symptoms, only the progesterone pills might cause some symptoms like bloating, like abdominal cramps, like vaginal discharge. Other than this, you will have no symptoms. Don't wait any symptoms of pregnancy until the HCG test. Just do the test on time. Before that, not any symptom will help you discriminate if you are pregnant or not.
How long should one wait for sexual intercourse after the procedure?
Don't have any sexual intercourse after you know that you're pregnant or not. After that, you should consult your doctor. If the doctor allows you to do so, you can have sexual intercourse, otherwise no.
When should a pregnancy test be done after the embryo transfer?
10 to 12 days.
What complications may arise during and after embryo transfer?
There is usually no complication. There might be, during the transfer, it might be a hard transfer. Due to the cervical os, the opening of the uterus, the entrance of the uterus is called the cervix, might be closed. It might be hard to pass through this canal inside, to put the embryo inside the uterus. It can be a hard transfer. If it's painful, if the doctor is not successful entering the uterine line, then it will be a complicated transfer. If the doctor cannot pass through the catheter inside the uterus, then the embryo transfer might be delayed and the embryos might be frozen. But usually there is no complications of that.
Is it normal to have a light bleeding or cramping after embryo transfer?
In very rare cases, if it's a hard transfer, to put the embryo inside the uterus through the cervical canal is hard. If the doctor is having some problems during that procedure, you might have a little bit spotting, otherwise no.
How do you manage stress and anxiety that may occur after embryo transfer?
We are always in contact with the patients. That waiting period up to the pregnancy test is very stressful for the couple. If they have any questions in mind, they usually ask us. We are in contact with them all the time. So it's the time, 12 days is too long for them. So we always give the best we can.
In which cases should a doctor be consulted during and after the embryo transfer?
If there is any problems with the pills uses, the progesterone pills, if there is any bleeding, if there is any fever, any infection, that is dangerous because that negatively affects our result. Anything happens during that period, we should be informed about that.
Thank you very much, doctor.
Yeah, thank you. Bye-bye.